everyone. Thanks for having me here. And I'm going to talk to you about the situation in Afghanistan. So let me start with this slide. Yes, slide is moving. In the weekly data show here, you can clearly see that the pandemic in Afghanistan progressed in 3 waves. So far, we had over 73,000 PCR confirmed cases and 3,000 deaths have been reported in the country. The third wave started in March this year and cases are still rising. The Ministry of Health did a countrywide seroprevalence survey right after the first wave and found a very high levels of COVID prevalence, reaching to over 40% in certain provinces. This map shows the number of confirmed cases in the provinces. The named provinces are locations of MSF projects. You can see that the entire country was affected, but also that the number of confirmed cases in urban centers like Kabul and Herat is higher because of the better testing capacity there. During the second wave, which is shown here, the picture is similar, although the overall numbers have been lower. And here is the third wave, where you can see that the southeastern side of the country, including Kabul, is more affected than the west. This is thought to have 2 reasons. One is that the wave is thought to have originated in neighboring Pakistan, where a larger wave was seen recently, possibly because of different virus variants. The other reason is that the test capacity in Kabul increased a lot, starting with the second wave, but remained more or less the same in many other parts of the country. Let's now have a closer look at the situation in the province of Herat. Herat is located in the west of Afghanistan at the border to Iran and has important border crossings. The population is estimated to 1.8 million, and 1/3 of which live in Herat, the main city. There is also a high number of internally displaced living in many different large and small settlements in Herat. MSF started a project in Herat in March 2018 and was involved in the COVID response since the early days. Here you see the weekly lab-confirmed COVID-19 data from Herat. You can see that the number of confirmed cases and deaths in the third wave is still hardly visible, even if there is a slight increase. As said, the testing capacity in Herat has remained low. Now, MSF has been running a COVID-19 triage at the Herat Regional Hospital, a major referral hospital, since April 2020. You can see the data from this triage here. Since then, 33,000 patients, or a bit more, of suspected COVID have been assessed and oriented towards appropriate care. Almost 2,000 patients with severe suspected COVID have been identified. In the top row of the figure, you can see that the number of suspected COVID patients at our triage clearly shows the third wave, conversely to the number of confirmed patients seen on the previous slide. In the second row, only the suspected with severe symptoms are shown. Also here, an increase over the last weeks is clearly visible. And the third row shows the proportion of people under 50 years among the severe patients. You can also see that we have an increase during the last weeks, and that we are now between 40 and 50% of people under 50 among the severes. More detailed analysis at the patient level is currently underway, and here is a few initial findings. First, when looking at the risk factors of patients presenting with severe COVID, shown on the figure, you can see that severe disease is more commonly associated with chronic lung disease and hypertension in the current wave than before. Secondly, and not surprisingly, patients with a longer delay from symptoms onset to presentation at our triage are more likely to have severe symptoms. And thirdly, these delays to triage decreased significantly for severe and non-severe patients since the first wave. With this, I'm already coming to my conclusions. First of all, as you have seen, there's a third wave ongoing in Afghanistan and also in Herat, and the number of severe patients we see is increasing, and there is a clear increase of the proportion of younger patients also. All of this is seen in a context where the measured seroprevalence after the first wave was already over 40%. So this situation points towards a complex interplay between population immunity on one side and effects of COVID-19 variants on transmissibility and severity, and makes the epidemic progression very difficult to predict. Despite being demanding in terms of resources, the triage of MSF helps to identify severe patients and orient them towards appropriate care, and also allows us to monitor the epidemic, as seen in the data I've shown. With this, I would like to thank everyone who was involved in this work, especially the teams in Herat. And I would also like to mention that in Herat, MSF is not only doing triage, but also is involved in case management. And Elizabeth is going to give a presentation about the patients there right after me. So thank you very much.